All right, guys, so we're gonna start with veins. It's just the one that's after arteries. So we're gonna start with dural sinuses. So something just to note as we talk about it, this confluent sinus, everything after it is paired. So all these things down here are paired. But we'll start with this superior sagittal sinus and inferior sagittal sinus. These guys come down and drain. This one goes through a straight sinus, and they meet up in this confluence of sinuses. And like I mentioned, everything after that just becomes bilateral. So we have a transverse on two sides, sigmoid, superior petrosal, inferior petrosal, and the cavernous sinus. From here, we're going to jump into the cavernous sinus down here. So here's those two connections, inferior petrosal and superior petrosal. This sits in the sella turcica, but it's also fed by the superior ophthalmic vein and inferior ophthalmic vein. It has these little emissary veins that come across it, and this connects to the pterygoid plexus, which we'll talk in just a minute. All these things are in the lateral wall, cranial nerve 3, 4, V1, V2. I like to write the numbers. If something were to happen to the cavernous sinus, the nerve that would be affected the soonest would be cranial nerve 6 because it's on the medial part. And then we have the internal carotid artery running through it. Some pathology associated with the cavernous sinus is a syndrome. You can have thrombosis, which is a blood clot, tumor, aneurysm, which is when a vein would blow up, fistula trauma, and they result in pain in the eye, swelling in the eye, ophthalmos, whatever that means. It's just when the eyes kind of protrude out of the head. So after we get these emissary veins, we have this pterygoid plexus down here. So here's the cavernous sinus, pterygoid plexus. Something that was in the notes, well, in the big picture from class, is this inferior ophthalmic actually feeds both cavernous and the pterygoid plexus. But in her notes, like on the slide on pterygoid plexus, she doesn't have the inferior ophthalmic feeding it. But we have deep facial, which is connected to the facial. It comes down this way. We have the emissary veins, and then we have that maxillary vein, and that runs parallel with the maxillary artery. So that second and third part run parallel with that. And another big thing is that it's in the infratemporal fossa. You might be able to get this confused because the pterygopalatine fossa, you would think it'd be in there, but it's not. It's inferior to it, so it'd be the infratemporal fossa. And the only other pathology with it would be superficial facial. Goes into the deep facial. This is like if you have like a boil or something like that on your nose. Goes from superficial facial, deep facial. The infection can spread to pterygoid plexus and then end up in your cavernous sinus, and that could result in death. But here's part one. I'll do the big picture of all these veins running through the head next.